Dr. Kazmirchuk studies AI-assisted drug design. He became a scientist to help people. His current work focuses on the development of therapeutics and diagnostics for bleeding disorders. Not only does it help him channel his passions, his research will also have a very real-world impact on improving patient care as well as quality of life throughout the world. Here's Dr. Kazmirchuk.
Passion, like blood, unites us. Some of us apply our passions to creating beautiful music, like we just heard. Others construct wonderful structures, like the Live Lab. More still, apply their passions to curing diseases. I apply my passions to improving patient care and quality of life for people with bleeding disorders. In doing so, I'm designing the future of medicine. We get injured, we then bleed, and then we stop. This process takes about 15 minutes and is due to coagulation and clot formation. However, not everybody can do this process effectively. In fact, every 1 in 4 deaths across the world are due to some sort of bleeding or coagulation disorder. What's more, 1 in every 10,000 people are affected with some sort of bleeding, clotting, or coagulation disorder. It is these people I am seeking to help. How? At Carleton University in Ottawa, we've developed an artificial intelligence that can design small molecules that can act as therapeutics and diagnostics to protein-related diseases. How it works is we take our protein of interest and we put it into our AI. The AI then intelligently designs small molecules that are predicted to interact with our target protein. At the same time, the artificial intelligence will discard any of these molecules, design molecules, that display off-target or cross-reactivity. In this way, using this AI, I designed 23 molecules to a platelet protein that, when mutated, causes a platelet disorder that is difficult to treat and even harder to diagnose. Now, I'm going to tell you 2 results that highlight this work. First, I'm going to tell you about a synthetic clot. So in blood and in this experimental system, a green mutated platelet protein will interact with a blue blood protein. I'm looking for a molecule that disrupts that interaction and thus will prevent or disintegrate diseased clots. So what will happen is this magenta molecule will interact with the green platelet protein and block its interaction with the blue blood protein. And this is exactly what we see. In this highlighted image, you see 2 pictures. On the top is a synthetic clot, and this is just in saline. And then with our magenta molecule on the bottom, you see that this aggregate, this clot, is completely disintegrated. And this is quantified on the far right, and this just shows us how potent and how effective, at least in the lab, our magenta molecule is. Now, I told you that clotting takes about 15 minutes. The other major question we had is, does this molecule that works, does it carry out its function in this time frame? In other words, what I did is I incubated the green platelet protein with the blue blood protein like this for 15 minutes. I then took that reaction volume, split it into 2 equal volumes, supplemented 1 with saline and 1 with our magenta molecule. The goal is to see whether our magenta molecule strips green off of blue. This, again, is exactly what we see. I'm showing you a highlighted image in a red box where you see a black blob. The black blob is indicative of the green and blue proteins interacting in saline. But when supplemented with our magenta molecule, you see nothing in the lane right beside it. This shows that the green and blue proteins are no longer interacting with each other. And this is a 100% ablation. This molecule is extremely potent. To that point, our molecule interacts with the green mutant platelet protein 15 times stronger than COVID binds to our cells. That's how strong of an interaction this molecule has, and its affinity is remarkable. Now, in the next few years, we're going to test this molecule in patients. I'm very excited to tell everybody here and online that we just got some results yesterday about the effectiveness of our molecule on patient-derived platelets from Italy. Our molecule was able to restore normal function of the mutant platelets in a diseased system. This is remarkable. We may have translated our molecule out of the lab and into real life. So, building on this, we're going to then test our molecule in mice, and furthermore, we're going to develop more diagnostics with our industry partners in Halifax and Hamilton, and with the goal of curing and treating and diagnosing diseases. For this point, the molecule I presented here, it is the first treatment and potential diagnostic for this platelet disorder ever. I hope you can see that we're truly designing the future of medicine. In other words, it's in our blood. Thank you.